It's time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, last Sunday's 60 Minutes featured Jon's report on the controversial practice of aid in dying. Oregon was the first state to legalize it 18 years ago.
And during his reporting, Jon spoke with Elizabeth Walter, who has advanced colon cancer. She talked about the importance of having honest discussions about end-of-life issues.
When we shine light on anything, it gets better, you know, and I think that we're all getting older, let's face it. This country is facing as in education we call it the silver tsunami. We're all going to face this. This isn't something we're getting away from. And the more we can have a conversation about death and how that's handled and be okay with it, I think the better our society is and the more loving we all become.
All right, good morning to the both of you. Jon, we'll start with you. Where does the conversation go from here?
Well, hopefully it widens. The aid in dying conversation is a small sliver of the bigger issue of end of life. And as a country, we are just not very good, for a lot of reasons, at embracing that. Now, there are areas where there's been a lot of improvement. Hospice, for example. The people who I've met who work in hospice, they are amazing, and there have been tremendous advances in that field. But we still have a ways to go.
I also think, you know, so just on an individual level, I know I'm trying to do better in my own practice talking to patients about end-of-life issues. Do they have a healthcare proxy? Do they have a living will? Have they given thought to what they would want as they near the end of their life or what they want their family members to know about that?
Do you guys find it's a very polarizing issue? Because it certainly seems that way whenever it comes up, that people have very strong feelings about it.
Well, I think the narrow issue of aid in dying is polarizing, and the country certainly is divided about that. There's a national conversation that's bubbling up. In terms of the whole issue of end-of-life discussions, I think it's just harder. I think as physicians, we don't start the conversations. We think of death, unfortunately, as a failure too many times, rather than a normal part of living, and we have to get better at starting that conversation with our patients.
Sure. There's a great focus on, you know, as physicians, taking care of patients and keeping them healthy and taking care of them toward the end of their life. But rarely do we sort of cross over and say, once we are approaching the end of life, then let us help our patients do that as well.
And the time to have the conversation is not when you're staring death right in the face. It's earlier when you're feeling well, and you can have kind of a more relaxed conversation.
But a difficult conversation to have. Up next this week, the CDC urged doctors to stop overprescribing opioids, a group of painkillers that includes Vicodin and OxyContin. Now, this comes amid a growing epidemic of addiction. And I guess, Dr. Holly, we'll ask you this question now. What's the next step for the CDC, and what are they asking doctors to do?
Right. Well, this was the first time the CDC or any large government body really put out such specific recommendations about how to handle opioid prescriptions. The recommendations were focused on primary care doctors who give about half of the opioid prescriptions that are out there now. You know, the big picture, they really wanted to focus on a couple of things. You know, first and foremost, that doctors consider non-medications and non-medication therapies first before even considering non-habit forming medications, and then finally before considering the more serious painkillers. Other things, they want to make sure doctors have conversations with their patients right up front about the possibility of addiction, abuse, and overdose of the drugs. And then also once the drugs are started, they should be low dose, they should be short acting, and they should be given for the shortest amount of time, right? We shouldn't open up the treatment with, here's a month worth of pills. It should more be, here's 3 or 4 days worth of pills. And I think by doing that, we can really curtail some of the explosion of use that we've seen in the last few years.
But you have to have a prescription. So in your view, how did we get to this point where there's so much prescribing?
You know, I spoke to Dr. Tom Frieden, who's the head of the CDC, about this, and he puts the blame squarely on the shoulders of us, of the physicians, especially the primary care physicians. Since 1999, the number of prescriptions for opioids has quadrupled, but the amount of pain that Americans describe stayed the same. So we are simply overprescribing, and we're underappreciating the bad side effects, and we're overestimating the benefits. So we have to do some going back to school and learning how to treat pain.
So, Dr. Holly, what are people with chronic pain and also doctors who are treating these people supposed to do as a result?
Sure. Well, DeMarco, I mean, sort of picking up on what Dr. Jon was just saying right now, not only have we had a shift in the understanding of the serious risks of these medications, we're also shifting our understanding of the effectiveness. There are great limitations on the effectiveness of these drugs. If you take, for example, many forms of low back pain, those respond better to exercise, physical therapy, stretching, yoga, even mindfulness. They respond even better to those things than the serious painkillers that we're prescribing a lot of now. Also, other medications that aren't habit forming, ibuprofen, which is Advil or Motrin, acetaminophen, which is Tylenol, all of those things should be tried first. And then only the prescription opioids really should be seen as a last resort.
Well, speaking of addiction, it is a common question for anyone looking to kick their smoking habit. What's the best way to quit? A new study might have an answer. Researchers divided nearly 700 adult smokers into two groups. One gradually reduced smoking, the other quit suddenly and completely. Both had access to nicotine patches and other replacement therapies. After 4 weeks, 49% of smokers in the group that quit abruptly had stayed off tobacco, compared to only 39% in the gradual group, so like a Band-Aid. Was the best way.
It's just cold turkey really was the best way. You know, when I have patients come into my practice that successfully quit, so many times when I say, how did you do it? They say, I woke up, I threw out the cigarettes, and I never looked back. And I always say, I want to bottle that. What was that moment right before
huge moment,
that?
a defining moment for them.
Yeah. And if only we could figure out how to get patients to that point, we could help so many other people.
We were talking about opioids, you know, withdrawing from nicotine, some experts say is as hard as withdrawing from heroin, and in my experience, that's actually true. And if cold turkey doesn't work, whatever it is, there are lots of other modalities.
All right, Dr. Jon. Well, finally, want to improve your health? It's a good question. Australian researchers have some advice. Retire. You heard it right. Retire. Their analysis found that after retirement, 25,000 older Australians were more active, decreased their sitting time, and were less likely to smoke and got more sleep. All factors linked with better overall health.
Sign up for that? Like,
I don't mind. I'm out of here.
Yeah, but I have to say, I've looked at this literature over the years, and it's all over the place, whether you're happier, unhappier, healthier, less healthy, and it depends. If you're retiring because you were just fired because you're in bad health, then it's going to be one thing. If you retire because it's the end of a wonderful, glorious career,
have to go out on a good note.
Yeah, good, and you have plenty of money to live on, then that's different. So
that's interesting.
Yeah.
There's a right and a wrong way to retire, right? If you keep up your social connections and you stay active and you do all of these good things, that's the right way. If you slow everything down, it's not as good for your health.
All right, well, Doctors Jon LaPook and Holly Phillips, thanks a lot for joining us.